Dear friends, welcome to the show Talk with Your Doc. I'm Dr. Prashant Tijani and with me is Dr. Kurshal Dighe.
Hello.
Dr. Dighe is a cardiologist at Thunder Bay Regional Health Science Center. Today we are going to talk about coronary artery disease, also called as ischemic heart disease or heart disease. Coronary arteries are the blood vessels or vascular channels which supply blood to the heart. Normally there are three coronary arteries which are the major coronary arteries, and there are smaller coronary arteries which supply blood to the heart. And these coronary arteries are soft, pliable, smooth, and they are patent. However, due to disease condition called as atherosclerosis, a block or obstruction is caused within the coronary arteries and it reduces the blood supply to the heart, resulting in a disease called as myocardial infarction or heart attack. In 2016, 370,000 patients died due to ischemic heart disease or coronary artery disease in North America. And it is estimated that 1 in 3 people in North America suffer due to cardiovascular disease. And the incidence of this disease is growing every day. Today we are going to talk about various causes of coronary artery disease, investigations, treatment, and how to prevent it. And with us is Dr. Kurshal Dighe. Welcome, Dr. Dighe, to the
Thank
show
you.
Talk with Your Doc. You might be seeing lots of patients with coronary artery disease in your practice.
That's right. I work as an intervention cardiologist, so we see a lot of coronary disease every day.
And the incidence is growing every day. And what do you think are the causes of increase in the incidence of coronary artery disease?
You can put kind of causes as main as modifiable factors or non-modifiable factors. So age is the biggest risk factor for coronary disease, and it is something that we cannot modify. It's going to keep on increasing as we get older.
When you say age, what age it starts?
So the process of atherosclerosis really starts right from the beginning, since very early age.
Young age?
Yeah, very young age. It's just like it's so silent that we don't even realize anything happening.
Mm-hmm.
And this process takes decades actually to kind of manifest into severe blockages in the arteries. So by the time these blockages occur, we are usually in our midlife or even sometimes earlier, or in some patients even later. So it depends on the how rampant the process of atherosclerosis is.
So it starts at young age, say 10 or 15 years of age, is that right?
It could be, yes, absolutely. There are
And
actually
then-
some studies that are trying to figure out it may be as process starting as early as birth even.
Oh, so and then slowly this grows and then it ultimately causes the obstruction then?
That's right.
Now, does it affect the males and females both, or one gender is more affected than other?
It affects both males and females, but in general, females are protected. So females in general age slower than males because of protective hormone called estrogen.
Mm-hmm.
So after they finish their menstrual periods, around roughly at the age of 50, the chances of females developing coronary disease kind of gradually, catches up with males at the same age. But before the age of, even when patients who are menstruating and have the estrogen hormone, they still can develop coronary disease depending on how many risk factors they have.
So now when you say risk factors, what does that include?
So traditionally there are risk factors, as I said, is modifiable and non-modifiable. So non-modifiable factors are not in our hands, main is age. But modifiable risk factors are definitely something that we can change. And amongst them, the commonest causes would be high blood pressure or hypertension, development of diabetes,
Mhm.
number of years you are diabetic,
Mm-hmm.
high cholesterol, smoking, sedentary lifestyle.
So you said smoking is a risk factor for coronary artery disease. So how does the smoking cause the heart disease?
So smoking in general or any other risk factors, what happens as the process of atherosclerosis, typically the lining of the arteries are pretty smooth when we are born or an early age. And as this lining of the heart or arteries or any arteries so that in the body, as they get damaged, they form lumps and bumps in them. And these are deposits of fatty tissue or cholesterol particles that over the time period can cause turbulence in the blood flow.
Mm-hmm.
So when you have a smooth lining of the arteries, the blood flow is pretty smooth.
Smooth.
But when you have more of turbulence in the blood flow, the chances of damaging the inner lining of the heart arteries is high. And this kind of leads to worsening of or more accumulation of cholesterol particles to the extent that these lumps and bumps gradually grow in size, and eventually they can form calcium deposits at later ages and even cause more severe narrowing in these arteries.
So you mean the smoke or chemicals in the smoke cause the damage to the inner lining epithelium of the or inner wall of the vessel, and that leads to this development of a atherosclerosis or plaque? Is that?
That is the presumed mechanism in smoking related. But even in patients, for example, who have hypertension or diabetes, they have other mechanisms similar to those smoke related that cause damage to the inner lining of the arteries.
So smoke or hypertension or diabetes, all of them, they cause damage to the inner lining of the blood vessel.
That's
and
right.
then result in a plaque formation and causes obstruction.
That's right.
Now, you said sedentary lifestyle is a risk factor for coronary artery disease or heart disease.
Right.
How do you define the sedentary lifestyle? You know, I'm sitting all the time in my office, so.
Right. It's hard to define what is sedentary lifestyle. So in general, what I say is, when you're a child, for example, you do a lot of sports or activities or even play around the house and you sweat every day. So that is a good amount of exercise you get on day-to-day basis. So as we get busy in our lifestyle, or you have family and kids and so on, that you don't do as much of physical activities that make you sweat. So I tell my patients is, if you do whatever activities that don't make you sweat, probably you're not doing enough of these activities. So if you exercise or somewhere that you produce good amount of sweat, that is a good amount of exercise that you're doing. So in general, we don't do so much of exercise that leads to some amount of sweating in that way.
Is there any study which says that so much amount of people getting heart disease who did not do the activity and who did the activity?
No, because sometimes, rarely you'll see some patients who are very active who still come with heart attack.
Right.
So it's not like yes or no saying, oh, if you do this much of activity, you will never get a heart attack. In medicine, you can never say never is never. Sometimes you get in trouble despite doing all the best things you do, but that is what life is.
So sedentary activity or less physical activity, how does it cause damage to the arteries?
In a way, like sedentary lifestyle, it increases your chances of diabetes, or it increases your chances of developing hypertension, or being sedentary and probably you're having more calorie intake than what you're spending, your overall cholesterol deposition in your body goes high. So those are that's the link between sedentary lifestyle and the reason why you can get heart disease.
So it's good to be active.
Absolutely. The more active, the better you are.
Thank you. We'll take a short break and we'll come back
Sure.
for the more discussion. Thank you so much. Please stay back for the next part.